The technology is a sensor technology that provides real-time data. So what that means is what actually happens at the tip of the electrode where it is implanted is displayed in real time on a monitor screen, say milliseconds later. At the moment, there is no form of real-time monitoring in tissues in hospitals. So when clinicians hear about our technology, they become very excited, and they've already highlighted a lot of mass market applications for us. We're going to focus on one particular application initially, and it's using an oxygen sensor in measuring the onset of compartment syndrome. Compartment syndrome is a serious complication that occurs in muscle tissue following increased pressure within that muscle that compromises blood flow to the tissue.
Someone who comes in with a massively traumatic injury like a tib-fib fracture, they run the risk of developing compartment syndrome in this due to the surgical nature. What this technology will do is it will detect the onset of compartment syndrome and will allow an intervention to take place. This intervention has the potential to prevent the loss of limb or prevent the loss of function in the limb, aiding in the patient's recovery, and it will also aid in keeping the costs down for the insurance people and for the hospitals themselves. It will also have an impact on the time that the patient is left in the bed and in the hospital, so it will massively reduce any of the delay in diagnosis and in the treatment of the patient.
Currently in hospitals there's a great time lag with existing technologies. For instance, in glucose measurements, they use discrete measurement, which means it requires to take a blood sample from the patient. The nurse then has to go put it on an analyzer, or else it's sent to the laboratory, and sometimes you get a delay of 3 to 4 hours before you get an actual single point back. So what happens in that 3 to 4 hours is completely lost. So the patient could deteriorate and complications could occur. Our sensor technology provides continuous real-time monitoring, so it's displayed on the screen what is actually happening within the patients. And now for the first time, doctors will have a tool that will allow them to make changes instantaneously that will greatly improve the patient prognosis.
What we're looking for is a business partner who can come in and help to drive the product forward into the commercial space. We're looking for someone who can develop a regulatory strategy, who can develop a commercial strategy, who can look at developing a business plan in order to source further funding and to provide investment for the technology in order to finally spin out a spin-out company or a HPSU. Basically what this device will do is we hope that it will change the face of medicine.